Well, good morning, viewers. Welcome to a special interview with the Director General of the National Agency for the Control of AIDS, NACA, Dr. Aliyu Gambo. This special interview is to commemorate the World AIDS Day 2021. Good morning, Dr. Aliyu.
Good morning. Pleasure to be here with you.
All right. I am not alone, viewers. I have my co-anchor with me, Winifred Obebo.
Good morning, viewers, and welcome once again to this special interview.
Well, Doctor, let's start quickly for want of time. The aid which just started yesterday. Can you give us a rundown of the activities lined for the year before we start to get into the key issues?
Usually, a week to the World AIDS Day, which is December 1st every year, we begin with press briefing to let the entire country knows that World AIDS Day is here and this is the week. Part of our activities of the week include roadshow. We trek from our office to a place somewhere. We're going to stay, attend to people, provide HIV testing and counseling, answer questions, and allow people to have direct access to us, before the World AIDS Day. And begin to remind people also that the year is ending and we want everyone to remember people living with HIV/AIDS and people who have died of HIV/AIDS and people who have provided services to fight HIV/AIDS. So that is happening today, the roadshow. And we have media activity like the one I'm having here with you. There will be activity with young person and adolescents. This is graciously sponsored by Her Excellency, First Lady of Nigeria, Haji Aisha. So, and then we have Flag Up to the World AIDS Day. And this is an event that is high profile, will take place a day to the World AIDS Day. And then we have the World AIDS Day where there will be scientific sessions, there will be presentations, and stakeholders will converge to now discuss our progress as a country and to see where we need to focus our attention more in the year to come. This is in addition to the prayer services that we always have at the National Mosque and also this year at First Baptist Church near Elaba.
All right. So for every country, there is what we call the national response plan. So
Right.
as far as our country Nigeria is concerned, where are we in the national response to HIV/AIDS?
We have been now almost 2 decades in the trenches fighting HIV and fighting HIV strongly. I can say for the last 20 years, if you go beyond 2005, say from 2001 to now 2021, we have recorded tremendous success, and we've recorded more success in the last 3 years than we have ever done in the history of fighting HIV in Nigeria. 3 years back, I think precisely 2.5 years, in 2019, when I resumed office, I requested for one thing. I said I want to see the list of everyone that is taking medication that has been identified living with HIV in Nigeria. I want to see the data. I want to see the dashboard. We want to count the numbers. And like a joke, our stakeholders and development partners rally around the implementers and made it a duty. Everyone must upload at the end of every month what they have done in the field for us to see. At the beginning, when were successful in getting everyone, onto that dashboard. The number showing then was 800 plus thousand, so less than a million. And we know that just from 2018, when we did the NICE survey, we have about 1.8 to 1.9 million people living with HIV in Nigeria. That's the estimate. So if we are hovering at 800 to 900,000 as of 2019, it means we have 1 million more to go. And 1 million more to go. This is the work we have done 17 years back, and has been strenuous. But we are seeing only 900, and we have 1 million more to go. What we decided was that, okay, we've already started community activity. So we expanded the community activity, going closer to the population and providing access to HIV services. And people knowing that HIV no longer kills. Now there is medication for HIV, even though there is no cure, but you can actually live with this virus until you finish your life on this earth and leave this world. Nobody will even know you have the virus. Talk less of the virus giving you the bad look that it does, or the virus hacking down your body defense mechanism, causing all sorts of illnesses that could even claim your life. So with that, people now respond more to HIV services, especially testing. People come forward to know about the HIV status. And if unfortunately the status is HIV positive, they do the needful, which means they access services where services are provided all over the country. So I'm happy to say today, as of today, we have 1.6 million people on treatment that we can see, that we can count. And the difference between what we have and what we are striving to have on treatment to make sure that HIV is under control in this country is now not more than 200,000 people. Yeah, from 1 million, we are looking for 1 million to put on treatment just 2.5 years ago. Now we are looking for 200,000 to put on treatment to feel comfortable that, yes, based on all the data that are available to us and based on the information that we have, HIV now is sufficiently under control. So what I'm saying is, watch out. The next 1 year, 1.5 years is going to be very, very phenomenal for HIV fight in Nigeria. Simply because we are at the verge of reaching that bridge. And once we reach that bridge, we will let everyone know that HIV is effectively under control in Nigeria. And when we say control, we are talking about arresting spread of HIV. Yeah, people don't now transmit it to others. And those that have it don't allow the virus to kill them. So you don't see people dying from HIV, and you don't see new infection, people acquiring new infection from others that are infected. So once that is done, then now we keep HIV within people that have it and keep it until we get a cure for it or until they finish their life on this world.
Okay, thank you so much, sir. You just mentioned that there's no new infection any longer, or it's now reduced.
It's reducing. By the time we say there is no new infection any longer, it means we have reached that bridge where we say, yes, it is effectively now under control. We are not there yet, but we are seeing light at the end of the tunnel. We're looking at that bridge as somewhere, you know, between now and the next 1 year or 18 months. Yeah.
You said the 1.6 are currently on treatment.
Right.
Okay, but generally on the Nigerian population, how many currently are living with HIV?
We have about 1.8, 1.9. That is the number that we believe live with HIV in Nigeria. It's a little below 2 million, as against the 3.5 million we were thinking in the past. Yeah.
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 Okay, so it has reduced drastically.
It has been recalibrated. And what we mean by recalibrated is that because we haven't done census, it is only when you do census you get to test everyone. And when you test everyone, you now find the actual number that, okay, we have 2 million people in Nigeria, and I am successful in testing the entire 200 million people in the country. And out of these 200 million people that I tested, I found 2 million people that are having HIV. So that gives me what we call the exact population parameter of interest. But if I'm doing survey, it means I'm taking a subset sample. And depending on how scientific and how valid my procedure is, once I finish the survey, whatever I get is going to come close to the actual estimate, which means instead of me testing 200 million people to know how many we have that have HIV, I can as well test 200,000 people if I carefully select them. And if these 200 people represent the diversity, represent what I have, what we have as a country, the estimate from that 200,000 is enough to tell me the entire story about the 200 million that we have in terms of number of people that have it. So based on that, we did that in 2018, and that is what we call the NIAS survey, which is to date the largest HIV population-based survey that was done ever in the world. So with that result, we know with some degree of certainty that yes, we don't have more than 2 million people living with HIV/AIDS in Nigeria. What do we have the exact number? The exact number is between 1.8 probably to 1.9 and not beyond 2 million. That range, we have a range. So, and based on that, what we are saying now, we have succeeded in identifying 1.6 million. Once we identify additional 200,000, we will now have this comfort within us that, okay, we have hit the roof in terms of identifying about 95% of people that have HIV or live with HIV in Nigeria. Those are identified. So if we succeed in placing 95% of those 95% that we have identified on treatment, yes, we succeed. If we do that, we succeed. And then we now count, okay, out of that 95% that on treatment, do we succeed in getting 95% of them virally suppressed, which means the virus is in them, but it doesn't get out and it doesn't kill them. Are we able to do that? Yes, we're able to do that. So once we're able to do that, it means over 80% of people that live with HIV in Nigeria have the virus under control. So once they control the virus, they don't give others. We don't see mass number of people coming with the new infection every year. So you may see new infection, but you see it small, tiny, teensy a bit happening here and there because of this 1% or 2% or 3% that we are unable to find. Not we are unable to find, they don't feel comfortable to come forward, or they treat HIV traditionally, or they treat HIV under some guise, or they don't even know they have the virus because somebody can have the virus and stay for 10 years without knowing they have the virus.
No, sorry, sir. As a follow-up to that, mother to child transmission of HIV was also a vexatious issue in the HIV response. So now, how is the situation like?
Thank you. Mother to child transmission is one of the 3 tasks for HIV that we must stop running before we control HIV. One is the general population, which is about closing. The prevalence was 5.8 in 2001, and now we are talking of prevalence of 1.3 in 2021. If I can put it in a context, if I'm to have everyone in Nigeria in one hole like that, and to close my eyes and pick 200 people at random, in 2001, if I did that, um, about 9 people or 12 people in particular, this is 5.8. So about 12 persons out of the 200 will turn out HIV positive. But now what we are saying is, if I repeat the same, have everyone in Nigeria in one room, and I randomly select 200 people and subject them to HIV testing, 3 may turn out to be HIV positive. From 12 in 2001 to now 3. So that is how it's shrunk among the general population. And that is what we are saying when we say we want to close the tap. So the tap is no longer running. The transmission is no longer happening. Now, the second tap that is running and has been running very fast and is the most important of all key affected population, because there are people at most risk of acquiring HIV. There are ways of transmitting it to other people, and these are the sex workers, men who have sex with men, the injection drug users, and transgenders. So the third tap that must close before we're able to HIV is mother to child transmission. And this is the tap that we have not been doing well over the years. And going forward now for the next 1 year, we've earmarked it as a year of fighting mother to child transmission. So the next 12 months is going to witness massive uptake of PMTCT. We're going to look for pregnant women wherever we can meet them. Before we wait until they come to meet us at the facility. But now we're determined to meet them at religious places of worship, at marketplace, at their homes, wherever they feel comfortable accessing our services. We provide the services to them. And if they want to do it by themselves, we provide the kits for them to do. Now you can test yourself for HIV in your room without anybody seeing you, and you can see whether you have the virus or you don't have. And you don't need blood. You can use your body fluid like saliva and have it.
All right, Honorable DG, let me take you to another question. So, when last did you conduct the National HIV Centre? What's the situation like in the States?
So, we haven't done Sentinel now for a while because just last 3 years, exactly in 2018, we had this largest survey ever on HIV, and that gave us the information we have been getting bit by bit by a Sentinel and not complete. So that one, if you like, is what they say is the complete survey that we were not able to do, and for which we are getting bits and bits of the information by a Sentinel all the years that have gone before that time when we did the survey. So now we did this survey in 2018. We're looking at the possibility of repeating it in 2023. We're done in 2018. Hopefully, by the time we do 2023, we'll now compare what we found in 2018 to what we are likely to see in 2023. And that will tell us where we are, how effective the control is over the years. So once we did that, and all these things we've been thinking and we've been working on turn out to be years through, and the global community will now bear witness that HIV is effectively under control in Nigeria.
But from the one that you said was carried out, where do you think states, where's the ranking of some states?
Now do you have the highest infection rate, lowest infection rate?
Okay. So if you look at our report, you will see states that are having high infection rates and those that are having low infection rate. But if I can sum them up and say the zones, okay, you will see high infection rate in the south and in the southeast, and you see low infection rate in the northwest and northeast. North central comes after the south and southeast in terms of ranking. So you have the southeast, north central, before you talk of southwest, northwest, and northeast.
So Northeast is the least.
No, Northwest has one of the least states that have HIV prevalence. I think in particular, I'm not forgetting, um, Zamfara is one of them.
Okay, Northwest.
Yeah, in the Northwest, yeah.
Well, okay, let's talk about challenges. Earlier when you opened in your intro, you talk about Nigeria now spending about 2 decades fighting HIV/AIDS. So how have you been coping with funding and other challenges?
Funding because of the donation we get from American government and the global fund to fight HIV, tuberculosis, and malaria, and also the support we have from Mr. President. Uh, we're very good with funding. Yeah, we're very good at funding. The area we have challenges, and we have been having this challenge, for the last 40 years. HIV has been existing in the area of stigma and discrimination. It is changing gradually, but it's still there. And what we want people to know is that it is a crime to stigmatize and discriminate against HIV people or somebody who has HIV because of their HIV status. And it is a crime that can be fined, or somebody can receive a jail, or a combination of fine and jail because of that. But what we want people to know is that discriminating and stigmatizing help the virus. It doesn't help us. So if at all you want to give us your contribution to end the AIDS in Nigeria, one thing you should learn to do is to encourage people to know about the HIV status. Anyone that doesn't know and that person appears to be at risk of acquiring HIV behaviorally or otherwise, that person needs to do that test today. You either access it at our facilities where we provide it free, or you do it yourself using self-test kits. If your status turn out to be positive, we want you to do the needful. And doing the needful is making sure that that HIV remains in you. It doesn't leave you to affect another person, and it doesn't give you sickness. And we can help you do that. You can live with that virus for the rest of your life without anything. And if you turn out to be HIV negative, we can also share information with you that will help you to remain negative for the rest of your life without acquiring HIV. So this is the help we want people to give to us. Know your HIV status today, and whatever it turns out to be, just do something. And doing something means if you're positive, keep the virus in you. Don't allow it to go out. Okay? If you're negative, don't take the virus.
Thank you so much, sir. You just mentioned the stigmatization of persons and discrimination of persons living with HIV/AIDS. I brought to my knowledge that actually since the bill concerning to law by President Village nothing much has been heard about the act.
There are cases currently in court in some places, and the persons that are involved are receiving assistance. We currently sign an agreement with.
But nobody has been sanctioned with the act.
So it's because the process sometimes takes time, and we haven't been broadcasting such things, but
Yes.
we will start broadcasting. One is stigmatization and discrimination, as we've said and we've talked about. Help the virus. It doesn't help us. Second, there is a government institution that is primarily shouldering the responsibility of protecting the rights of individuals and making sure that when those rights are breached, either privacy or confidentiality, whatever, that thing is reported to that agency. So we've made agreement with National Human Rights Commission. Whenever we have to get it, we transfer them to National Human Rights Commission and they take them up from there. Yeah, they give them cover and the code, and they make sure that justice is dispensed, and the individual that are involved receive what they deserve.
Like how many cases have you referred to the Human Rights Commission?
So that agreement was signed earlier this year. Yeah, so we haven't had much now to share. Maybe probably people are now becoming more conscious. They are not for whatever taking the risk in terms of you know breaching those privacy, confidentiality, and breaching the human rights um, of individuals that are infected and affected with HIV. However, we are watching and we're waiting. We've informed the patient community adequately. This is network of people living with HIV/AIDS. Whenever you hear of such cases, ask your membership to bring them forward and bring them to NACA, and we will do the needful on our side to link them up with National Human Rights Commission.
All right, Dizzy, let me ask you a two-in-one question to end this interview session. Yeah, I know earlier I asked you about challenges. I expect you to mention something about COVID-19. So let me now ask you properly. When it came, it affected all the aspects of our life, and a national response plan was unveiled. So was there a way, in any way, that the response to COVID-19 interfered with the national response for HIV/AIDS? And finally, the theme for the 2021 World AIDS Day is End AIDS, End Inequality, End AIDS, and End Pandemic. So tell us the relevance of this theme to your own national response plan.
Thank you. Beginning with COVID-19, yes, COVID-19 disrupted our services, especially during the lockdown. We were not able to dispense medication to people living with HIV/AIDS. One, because there was lack of transport, movement was restricted. Second, some of the facilities where we provide these services were converted to isolation centers. And third, then there was no infrastructure to test for COVID except HIV infrastructure. We had about 27 laboratories at that particular time. All of them were surrendered to NCDC to run COVID-19 testing. So during the day, we ran HIV testing. At night, we ran COVID-19 testing. And we also help the response with logistics, sample transfer. We created a replica of the center sample transfer system that we have and donated to COVID-19. Human resources for health, our workers that were trained, laboratory, and also at clinical side were brought in, including the community civil society organizations that give us volunteer services in the community. We are all deployed to support COVID-19 response. So that's COVID-19, one side. The second, you asked about inequalities.
Yeah,
Yeah, and inequalities and AIDS, and pandemics. Okay, so end pandemics here is talking about dual pandemics, and HIV and COVID-19. Okay, okay, yeah. So but end inequality and HIV now is talking about HIV solely, and what we are talking here is provide access to people who don't have access in the past. Provide equal opportunity for people now who are marginalized. Marginalized individuals are the vulnerable population group that don't have access to HIV services. Like I'm saying, if we say 80% of people that live with HIV have been identified, where are the balance of the 20% who have not been identified? These people may probably be disadvantaged group, a marginalized group. They may be socially disadvantaged, economically disadvantaged. There may be gender-based differences that is making them deprived and disadvantaged. So all these communities, this group, we want have access to them. and we want our services to have access to them. So that's what we are saying. As we push for the last mile, let us not forget these communities, and let us make sure we carry them along. Otherwise, we cannot end AIDS without making sure they are on board.
All right. On that note, we have come to the end of this special interview with the Director General of the National Agency for the Control of AIDS, NACA, Dr. Aliyu Gambo, to commemorate the 2021 World AIDS Day slated for December 1. Many thanks to you, Dr. Aliyu.
Thank you for hosting
And
me.
we hope to see more when we interact.
Yes, and I hope to get your invitation more frequent than it has been. Yeah.
Thank you, viewers, for being with us.
Thank you.
From I am Winifred, it's bye for now.
Bye.
Thank you for watching. For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word.